Welcome to Pause for the Truth, where you can sit back, relax, and hear an honest dialogue about health, wealth, legal, and social issues. The hosts are Dr. Rogers Kane, family practice physician, and Jocelyn Turner, health education consultant, with co hosts from the Northeast Florida Medical Society and its foundation. Stay tuned for the truth about matters affecting you and your family. We're here to tell you what's really going on and why. Good evening and welcome to Pause for the Truth. I am Jocelyn Turner. Such a pleasure to be here tonight. It's been a tough week for me. I'm not going to tell you why. I'm used to telling you all my business, but I'm not going to share my business with you all tonight. I'll just say I am thankful to be here and always excited about the topic that we are about to embark upon tonight. Of course, I cannot do this alone without my wonderful co host, Dr. Rogers Kane. Dr. Kane, I'm happy to see that you made it through all that traffic tonight.
I was just about to say, you were almost about to do it without your wonderful co-host. I find it ironic. You say I can't do it without my wonderful co-host. When they introduce us, when we go to sign in and it asks us, "Oh, click on your favorite co-host," you know, I never get anybody clicking in on me, including me. I always click it on.
I
I always
know.
click it on
I'll admit, Dr. Kane, I've never clicked on your picture. I click on mine.
there. Well, I'm
Oh,
just happy to be here. I'm looking forward to this topic of these young ladies. We kind of brushed on it, talked about it somewhat on a previous show with Dr. Chandra Adams, right?
correct.
And
Exactly. Uh-huh.
she enlightened us on quite a bit, and I think that we're going to be even more enlightened on this subject matter. And this won't be the end of the story, as we let Dr. Adams knew back then that this will not be the end of the story. Usually, we ladies, this is y'all first time joining us, and welcome you both. Usually, we run out of time before we run out of subject matter.
Yep, absolutely. So let me go ahead, Dr. Kane, and introduce our audience to our wonderful guest tonight. From the Northeast Florida Healthy Start Coalition, we have joining us Faye Johnson, the Chief Executive Officer. How are you doing this evening, Faye?
I'm doing great, Jocelyn. Thank you all for having us. I really
Oh,
appreciate it.
absolutely, absolutely. And also joining Faye is Dr. Lavon Brown, the Policy Research Center Director, or let me see, Maternal Child Health Policy Research Center Director with the Healthy Start Coalition. How are you doing, Lavon?
I am doing well and glad to be here as well.
Well, wonderful. Tonight is, when we think about tonight's topic, maternal health disparities, just to think about that, just like why in the world in 2022 do we have health disparities related um, to women? Let me read something that I did a screenshot of. We try to do our homework before we start the topic. Let me read an excerpt from an article the other day. It says maternal and infant health disparities are symptoms of broader underlying social and economic inequities that are rooted in racism and discrimination. Differences in health insurance coverage and access to care play a role in driving worse maternal and infant health outcomes for people of color. Faye, I have
Yes.
to start with you. Do we have do we really have inequities in access to care in Jacksonville? I'm going to start with the easy question. Is access to care an issue here in Jacksonville, particularly when it comes to women's care? Or if you want to talk about the broader subject, that's fine.
Sure. And Jocelyn, you know me and everyone. I've been the CEO of the Northeast Florida Healthy Start Coalition for the last 7 years, but I've been in this space of maternal and child health for over 20 years. So when you ask the question, are there problems, issues, access for women? It starts long before that, Jocelyn. Actually, it starts when the women are children.
Mhm.
Um, the adolescent years, their health, as we look at that and they grow into adulthood. Many of our women bodies have already been impacted by trauma, associated determinants of health, underlying racial disparities, underlying systems issues. And so by the time she becomes a woman and becomes pregnant, her body has already been impacted. It's called the weathering effect. If you know the work of Dr. Michael Lew, you will understand through the life course that those things cause problems long before they become what is a known problem. Access barriers, even as teenagers, as we look at insurance, access barriers, as we examine the provider care of quality, access as it relates to insurance or the like of insurance where you can't get into a provider. We also have now we know of OB deserts in our area and primary care deserts where our families and women of color have to travel many, many miles to even get to a doctor. I don't know, in the community, those community-based care facilities are no longer accessible to a lot of our women. So when you talk about access to care, and as we look at this, you have to look back and historically as it relates to the wealth gap, redlining, all of those things that occurred for many, many years that position many women of color, to include myself, not to be able to access certain services. So, to answer your question, is there a problem with access? Most definitely. Does it start when a woman is adult? No. When she becomes an adult? No. It starts long before that time.
We've had these conversations in the past.
Mhm.
When we've had some pediatricians on the show talking about the care of children and the issues. I remember during my experience or time at the health department when we were talking about chronic health conditions, we talked about the fact that young people are being diagnosed with diseases that typically used to happen in older
Yeah.
people,
Yeah.
right? And
Yeah.
we you talk about diabetes, type
Yeah.
2 diabetes.
Yeah.
Back in the day, it used to just be type 1
Yeah.
diabetes, which typically affected children.
Right.
But then when you compound the trauma, as you mentioned, that exists unfortunately in so many communities. And Faye, you and I go way back from when we
Yes.
did the,
Yes.
let me just go ahead and let the world know. Faye and I go back and we collaborated on a Healthy
Yeah.
Start,
Yeah.
Healthy Families Jacksonville project back
Yes.
in the day.
Mhm.
And we had it easy, Faye, because we only
Yeah.
worked in one zip code, right? The
Right.
need
Right.
was so great in this particular one zip code and in other zip codes here in Duval County in
Mhm.
Jacksonville that there were teams of us, a
Right.
whole team of people dedicated to a zip code. And
Yes.
I remember the one project that I worked on with my zip code and Faye, Lavon, I'm gonna bring you in a second, but I have to go back to it because Faye brought up that we have to go back. So I remember when I went to the community in the zip code that Faye and I worked in, and I came with all of my data to talk about what we were there to talk about. But thankfully, because of my public health background, I knew we needed to listen to them
That's
first.
right.
And what was important to them is there's too much trash and garbage in their
Yeah.
neighborhoods, right? Can we
Mhm.
clean up our neighborhood? And
Right.
so, what I like about it, and Lavon, I'm going to bring you in on this too. What I like about it is that we listen to the community and what their needs are. So, now tell us, what are you doing now as a new member to Faye's team to help address some of these disparities that are existing in the communities?
Well, I tell you what, one thing that I'm doing, I have to say that I am a native of the zip codes that we're focusing on. Um, I was raised right here in Northwest Jacksonville, and they say you can travel all around the world just to get back home. So I'm glad to be back here and a part of the contribution. So one thing that I bring to the table with Healthy Start is I know the community. I know which neighborhoods have sidewalks, which don't. which have overgrown grass and weeds. And, I know the bus stops because I was raised on JTA on the bus stops. Um, and when we want our mothers to get to a doctor's appointment and they have to take the bus, we have to account for a lot of things. Is the bus stop sheltered? Is there litter and grass? Is there sidewalk access to bus stops? Is it in an area where people are adhering to speed limits? There are so many different factors. If we even just look at, and let's just say, on the community right now, if we look at, like you said, a lack of OBGYN services in our community, are there additional clinics in the community? I remember, and when I was a candy striper, it used to be called University Hospital prior to being Shands. We had a nurse. I still remember her running up the hallway, Elizabeth Means. And I went to college, came back, and there was like an Elizabeth Means Center, community center, I think on the east side. And I noticed all of these different community centers everywhere. Well, I left again, came back 10, 15 minutes later. They're no longer there. So we talk about, access. We talk about transportation. Well, I spoke with a young expectant mother a week ago, and she said that she called one of the services at the hospital to get prenatal care, and they said they didn't have an appointment until January. Fortunately, an appointment became available, and she was able to get in the next day. But it can just go on and on. Right. Let me also say that when I say I know the community, we can think about a strategy called mapping assessment and actually look at accessibility. And, in addition to accessibility, if someone is walking to the bus stop and they stop at the corner store to get something to eat, and what does that corner store serve? Nothing healthy. We have our food deserts, and we also have food swamps. The food swamps are the areas in the food deserts that are inundated with liquor, that good stuff, with liquor and the foods that are high in saturated fats. So in addition to our OB deserts, we have our food deserts and food swamps. Not to mention the violence. And again, this is my hood. 32209, my great grandparents had like 5 acres over there on a farm. When I say I really do, I believe we need to value these communities, but we have to know what's going on in the community. Just like you mentioned earlier, you listen to the needs of someone. That's what we have to do. We have to do like an assessment of what is there, what the communities are lacking, and again, go in and listen to the needs and bring value back to the communities, especially the children.
So Faye, let's talk about, I know you received some funding recently, and bravo for the work that you've been doing over the years and obtaining those dollars. Tell us about this new initiative, either you or Lavon. Like, what are you going to do? What are you going to do now, Faye, that we didn't do years ago with our other project?
Jocelyn, that's an excellent question, because what I have realized through this work and in this space for many years, how should I say this? There comes a time when we have a lot of programs, a lot of services that are needed. And without those services and programs, the disparities would probably even be worse, okay? So when you take a step back and you look at it and you've had an opportunity to really examine some of the root causes of infant mortality and maternal mortality, you have to go upstream and start looking at policies. You have to go upstream and start truly looking at what's driving the disparities. Why aren't people allowed to live as a family in certain federal properties because they have felonies and things like that? And I get it. You need rules, but what does that do to the fabric of the family when a father comes back, he's done his time, he's trying to make things right, he wants to live with his family, but he can't afford to live, in a regular apartment. And right now with the housing crisis that we have, it's even worse. So what we decided, and I sat back and I said, you know what, we need to go upstream. We have to look at systems issues that are designed a certain way to get the results that they get. And to do that, you have to look deep into the policies and not feel that, oh, it's never going to change. You can't change anything. We can change some things. We can. I believe that. And so thereby, we were fortunate to, not fortunate, I think it was time for us to look upstream, deeper work. And so what we have established within the Northeast Florida area is the first Northeast Florida Maternal and Child Health, Infant Health Equity Policy and Research Center. And we're funded for 5 years, recently funded. And I think I've hired an awesome Dr. LaVon Brown to be the head of that center and to lead this work. Like she says, don't do for me without me. She knows the community, she knows policy work. And so I'll let LaVon tell you some of the things that we will be addressing, the four main benchmarks that we're focusing on around policies. Now remember, this is systems work, this is policy work. This is not about designing another program. It may be about dismantling a program through policy, depending on what that looks like. So LaVon, you're on mute.
Okay. All right. So we're actually focusing, our health grant is stemmed from the Healthy People 2030 goals. And we're focusing on preventive services, increasing prenatal care for women. We're focusing on increasing adolescent preventive services. We're actually focusing on decreasing the survey, the percentage of patients that that reported they had poor communication with their physicians. Dr. Kane, you could probably elaborate on that a little. And so there is one more. Let's see, what did I say? I said
Family
adolescent.
planning.
Family planning, the big one. So remember when we had home economics, did anyone go to Northwestern? Because my parents actually had the same teacher that I had, but we had a phenomenal home economics teacher, Miss McFarland. And back then, it was holistic. They talked about family planning in all different avenues. So we are actually trying to increase and promote family planning, because just like Faye said, this starts long before women start even talking about pregnancy. And Dr. Chandra, is it Dr. Adams? Dr. Chandra was on a few weeks ago. They talked about actually how, talking about pregnancy is taboo at a certain age. And then later on, when it's time to start talking about it and planning, sometimes it's too late for women. But those are the 4 goals
Right.
that we're focusing on. And then from there, we have benchmarks and activities. The biggest thing that we're doing to drive policies upstream is we're doing a lot of collaborating. And we're collaborating with maternal child health partners and non-maternal child health partners. We have.
Oh, I'm sorry. I wanted to interject something real quick. I was dying to say it, Faye, because I mentioned it a couple of weeks ago when we were talking with Dr. Adams, is that when I attended the Florida Public Health Association conference, like 10 years ago, probably, it was at that time that the light bulb, I was enlightened, that I had that aha moment brought in front of me. We talk about systems and programs, federal programs that are in place. The WIC program, Women, Infants, and Children.
Right.
Where is the man in that system?
Right.
Right? What resources? And Dr. Kane, you're shaking your head. You felt left out, didn't you? Right? So we know that woman couldn't have that baby by herself.
Right.
Okay. So where is the man? I mean, when you talk about dismantling systems or either revisiting, revamping them, and then the federal rules that the woman will get kicked out of Section 8 housing if the man moves in. Where
Right.
is encouraging healthy relationships in that?
Right.
So
Take-
if we have any elected officials that are listening, so that you all won't do the work alone, what can
Right.
our elected officials do to help us revisit, revamp those systems, or even some of our business leaders? What can they do? Can Dr. Kane and other members of the Northeast Florida Medical Society or whomever, start advocating and saying, look, these are two things to me that are simple and easy. What do we need to bring
Sure.
to the table? What do we know about the health of the men when they
Right.
are being the contributor to that
Right.
that baby being conceived?
Right.
Sure. Sure. Dr. Kane, you're on mute.
There we go. Let me make one quick correction. You say, they're taking a woman, taking the home away from that woman. If there's a man there, they actually taking the home away from her and her kids.
Right.
Mhm.
Okay, it's not just taking it away from that woman as if she is standing alone and just having
Right.
her man over just so they could
Yeah.
do
Right.
whatever
Yeah.
somebody's you know,
Yeah.
imagination, perverted thoughts can be. It's about her
Mhm.
having a place to raise her kids and trying to make sure that her kids have their father with them. But
Right.
all kinds of obstacles are being placed in their way for that family to stay together,
Right.
especially the black family. Now, I'd say the elephant in the room is the black family that is predominantly being affected by this.
Yeah.
And Dr.
And
Kane,
and
I'd like for you to chime in as well. And any of you can, but I'm
Mhm.
putting it on you because I'm about to ask a medical question.
Uh-oh.
Why is it, I know you're not an OBGYN or a pediatrician, but as a family practice physician, why is the health of African Americans still so far behind in
uh,
so many different categories? What's happening?
And you don't need to be a physician to answer that. Be quite frank with you, it's racism. I mean, that you can dress it up and call it cultural insensitivity, a lack thereof, a lack of cultural sensitivity. But it's racism. I mean, it's pretty much that's what it is. I mean, you don't.
Explain that. What do you mean? What does race have to do with that question? Uh,
Well, I mean, somebody mentioned redlining. I thought they mentioned redlining of neighborhoods. I mean, it doesn't have to be somebody standing in front of you and calling you the N word and shaking their finger. There
right.
are backdoor ways that have been for at least decades that have allowed racism to take place when and I know this is a little bit uh, extraneous, but when the vets came home from World War II, all the housing that was offered up under these governmental grants were basically offered to white families. Black families did not have access to it. You get the redlining with loaning and people trying to get a house. It's I mean, that's just kind of a very basic thing as far as housing is concerned. Then if you turn around and start looking at the physicians, the medical practice itself, well, I see a lot of that still in a lot of racism still in medicine. Just because, you got to remember, doctors are a microcosm of society. Okay, but we're just like the rest of the society in terms of what exists within that microcosm. You got racist people, you got gay, you got um, smart, dumb. We're just like anybody else as far as it comes down to human nature. So you see a lot of racism, but you don't see a lot being done to address that issue that we're talking about. But it's the system that sets us up for failure when it comes down to adequate and equitable health care.
Well, I tell you what, I hate when I turn on the news. Thank you, Dr. Kane. I hate when I turn on the news and I'm happy. I hate it in one sense, but I'm happy in another sense when I see the stories of men whose wives died during pregnancy or postpartum, right?
Mhm.
They're healthy. What's appeared to be a healthy wife went into the hospital to have a baby, and not necessarily the first baby. And then that father is bringing his baby home without the mother. Faye, that's heartbreaking. And also on the flip side, there are women who go into the hospital expecting to have a healthy baby, and they're leaving the hospital alone because
Mhm.
their baby died, and or the baby died as a result of, within 1 year of
Right.
birth.
Right.
And you have to have committees to look at infant deaths.
Yeah.
Like, really, in 2022, what is going on? If you're just joining us, we're talking about maternal health disparities. We're talking about the factors that are related to why so many African American women or women of color are disproportionately impacted by, in terms of death and or to the mother or to the child. If you have a question or comment, call in at 1-888-669-1280. And ask one of our guests, Faye Johnson and Lavon Brown, what is the Healthy Start Coalition doing to address this? Thankfully, they do have a wonderful board of dedicated folks, a lot of community partners out there that they're working with, really trying to address the issue. But if we all know in the work that we do, sometimes it takes those non-traditional people to get involved because they may be able to enlighten us. Maybe it's time to bring the JTA folks, the transportation people to the table, the JEA people to the table. Because if you're worrying about your electricity being cut off, you talk about the stress of that, the burden of that weighing down on you as an expectant woman. If you're going to work with unliable car and you're told you're going to get fired if you don't if you're late again, people don't know. And I used to remind my colleagues of that. When a mom shows up to her pediatric appointment late, it's not because she's being defiant. You don't know all that she had to struggle with to get to that appointment, right? Her car wouldn't start when she first went out. She ran out of money. She couldn't pay her gas, right? So we have to consider all of those things. I am fortunate to be working on something that Dr. Kane, and this is going to get back to you and Lavon, she alluded to it, is the patient provider relationship, right? Having the conversation, enhancing the quality, the communication between the patient and the provider. Hopefully, that patients will be forthcoming with what's going on with them, seeking the help that they may need. Maybe that doctor is not the source of what they need. However, maybe their office manager or their nurse in the office can link them to the resources that are needed. So, Lavon, tell me, you've been on this job for a few months now. So what are you finding is, and I don't want to put you too, I know your boss is sitting here, so don't let me get you in trouble. I want you to have a job tomorrow, so I'm gonna caution you with the answer. But what do you find to be the biggest obstacle thus far to do the work that you're doing? I know it probably seems overwhelming, but what do you think is the biggest obstacle for your success right at this point?
Okay, and let me disclose that I say in front of my boss what I say. But it's funny because we sometimes have meetings that I'm thinking, ooh, I'm so glad I didn't know about all of this before I took this job. But there are so many obstacles. One, first, just dealing with the city of Jacksonville, the state of Florida. That's a challenge. I did all of my research in the state of Mississippi. I was pretty invested in the community there for about 6 years, working with different entities. And one thing Jackson, Mississippi has done right is they have a public health corridor. It's called a medical mall. The Clintons and a physician named Dr. Shirley Aaron invested in it. And in this medical mall, if we could think of our Gateway Mall, but everybody has like a stake in it. The university has a cancer institute. All the not-for-profits are there. And so all of the residents in the state of Mississippi, they go to this one area. And so I think Houston a few years ago was talking about it. They may have something like that now. But
So you put it out
Jacksonville,
there. So you put it out there. If anybody wants to develop an area, there you go.
yeah, yeah,
Put all the resources that are needed in
right
one
there.
spot that
Exactly.
people won't have to guess where to go.
Exactly. Even our university, our School of Public Health is there. It just goes, children, there's a not-for-profit that helps children with developmental delays, but everything is right there. It's a public health corridor. And and there are similarities between Jackson, Mississippi and Jacksonville, Florida, which, we'll wait for another show for that one. But so that would be one thing. Another thing, and just dealing with the dynamics here, that leads into, I think it's more of a challenge in an urban area to collaborate. In rural communities, there it's just, we need each other in rural communities. When we think about,
Everybody know one another.
everybody knows each other, and you meet no strangers. If this mission is going on, it's easier to partnership with someone that has a mission. Not to say they don't fight, but there are more federal dollars coming because of the population there. Florida, has a different population and different monies, so partnerships, are a little more difficult. People are a little more competitive. I'm noticing that. I don't want to talk about the crab pot. However, it's more of a challenge here, to
We have to deal with politics too. So that's the
politics.
other part. Politics now. And Dr.
Right.
Kane is he'll tell you about that. The
Okay.
politics that we're dealing with. We've been doing a series on the future of medicine, or future of healthcare,
Mhm.
and politics has a lot to do with it in terms of, and Faye, you know it too, when
Mhm.
the Medicare, what is it, Medicaid dollars
Medicaid.
were rejected by our governor, that
Mhm.
people who fell between the crack then could not access primary care or medical services. Those are the people that we're talking about, who fall between. They're people who work every day. We don't want to give people a living wage. Let's talk about the other thing, right?
Mhm.
A living wage. And if you don't know what a living wage is, that means that you have enough money to take care of your family so that you won't have to access those public assistance programs. People want to make enough money to take care of themselves and their families. I don't know why that some elected officials don't think that they do. People want the same thing that we want. Now, we all know we have some bummy relatives who don't want to do the right thing, but that's not what this is about. So, Faye, there was a question posted. You said at the beginning, the
Sure.
work that you're doing is going upstream. Tell us,
Correct.
what does that mean?
So when you think about interventions, when we think of a problem, sometimes say it could be around teen health, adolescent health, right? Why aren't adolescents going to the doctors for their primary care visits and things like that? We think about developing a clinic, a teen clinic where these children should be able to access. To go upstream, you think about the policy of why aren't they accessing those services. You go deeper upstream. You just don't put an intervention in place. We have interventions, we have programs, but to go upstream, you think about the why. Why aren't they? And then you start to research. That's where LaVon and her teams come into play, and they do a lot of research around this to figure out what's causing them not to be able to access a teen clinic. Let's just not build another teen clinic. Let's go upstream, look at the policy that may be affecting this, meaning that there may not be adolescent health data of preventative care that's being really, how should I say, published, where those that can get it, that can change policy and issues. So it goes deeper than just the services by itself. So to go upstream, you're going up to look at there's a parable. So, and I know you guys have heard this, where and I'll use infant mortality. A lot of the children were falling into the river, they were dying, and the guy kept going, running over, pulling the baby out the river, pulling them out. And so the other friend said, to his friend who left and started running upstream. Said, "Where are you going?" He says, "I'm going upstream to find out why is this guy throwing these children in the river." So that's upstream work. So it's not the issue that's occurring at the time. You want to go up and really dig deep and see who's the guy or woman throwing the children in the river. What policy is throwing the children in the river and they're dying? What's
The
the
root
cause?
cause.
Huh?
You know what I mean?
The root cause.
Root cause. So that's
And
what you're doing. Yeah.
and I'm reminded of when you were saying that, I'm reminded of the prison to pipeline. What is it? Pipeline to prison. You know, the thought that people can predict how many people are going to be, how many third graders will be in prison. Like, okay, so somebody has figured that out. Like looking at third graders, why not look at it different? Why not say, of these third graders, how many of them might struggle, and what do we need to do to help them succeed?
Right.
Not the flip side of a percentage of these third graders are going to end up in prison. Do you know what I mean? So that's crazy to me that something as simple as that, in terms of changing our mindset about stuff. If you're just chiming in on the show, I know we're on the almost ending part of the show, but we're talking about maternal health disparities. And what you, if you don't know what that means that far the inequities exist in the health of women in this country, not just this country, I'm just going to say in here in Northeast Florida. So that's what we're talking about. You know, what do we need to do to go back? If before a female makes a decision to get pregnant, what
Mhm.
does she need to do? What does she need to know about her health? A couple of weeks ago, when we had Dr. Adams on, Dr. Kane, I don't know if it were you or who brought up taking folic acid, right? You know, what are those things you talk about? You know, Dr. Adams talked about
Yeah.
the obese teenager that came to morbidly obese teenager that came to her office, and the parent that said, I try to tell her not to eat so much. Well, she's not the breadwinner, literally, in the family. You're bringing the chicken nuggets and the french fries home for the child to eat. So you talk about so many things that we need to do. If you have a question of our guest, dial in right now to 888-669-1280. Again, 888-669-1280, as we talk about maternal health disparities. So
This way.
what can our listeners do? What do you need help with in order to help,
Sure.
do that upstream work?
I'm sorry, did
Because
you direct that to me, Jocelyn, or who? What'd you say? I didn't
whichever
hear the
one,
first.
Lavon was getting ready to
Go ahead.
chime in. So
Go ahead.
Okay. So what we actually need help with is joining our team when it comes when we contact you and we would like to have these discussions and focus on some initiatives and programs, implementing different things, looking at the gaps, what's missing. Join our team because we really do. We focus. Faye has been here at the onset on different levels, and her commitment to Healthy Start really brought me in. She didn't realize it, but we pay attention and observe. And so I just want to say that Healthy Start focuses on maternal and child health, and we want to be the conveners to lead and to get into the communities and to really make a difference, to focus on the various companies. So if someone works for a company, we can have conversations to talk about what are some things that can happen to make lives better. I always think about as a child, my mother worked for Blue Cross and Blue Shield. She was a single mother, catching two buses to get to work, two buses to get home. And really, we were baby kids when she was not watching. But what Blue Cross did is they would offer field trips to Disney World, and that helped us because she didn't have to pay for transportation. She did not have to pay for some things, just pay, I guess, for the tickets. And we kind of reflected back on that the other night. And she told me that those buses were filled with single women and children. And those are some things that help children, help families. And when we talk about those psychosocial things that help children, it's just so important, because if it's going to help that psychosocial level and the cognitive level, that's having a better health outcome. So there are different things that people can do, but join our team, because we would like to be the conveners, to go in and have some conversations so that we all know what policies need to be in place to help drive them upstream.
And Jocelyn, I'll chime in and add to what Levon has said. One of the things we know that through our Zero Preventable Infant Health Leadership Council, on that committee who oversees the center, their representation, like you said, from across the board, because we're addressing policy is about the social determinants of health and what's causing the root cause. Okay, so that's what it's about. So we have a lot of different stakeholders from city council, but not only from city council, we're looking at folks from JTA, we're looking at folks from the school system, because all of these systems play a part in the policies that's driving maternal mortality and infant mortality. So if one thing we want to really talk about, and Dr. Kane, I know you know this very well, when you think about stress and the weathering effects of stress on women through riding that bus with the children and trying to, rob Peter to pay Paul and all that good stuff, the stress hormone in our women, cortisol levels, we're looking at right now doing some research around that, because when you look across the country, and you see the majority of the women that are dying, African American women and babies across the country, the same group. What's driving that across the country? The infant mortality rate is high, the mortality rate is high. And so one of the things when you ask what people can do is start to really take a strong look at preconception health around what Dr. Adams was saying about the folic acid, but more importantly, the stress and how stress impacts the body over a period of time, how stress impacts the organs. I'm no MD at all, Dr. Kane, that's your world, but I do believe that stress in African American community is driving the high rates of hypertension, diabetes, obesity, all those things. So that young girl, if she's obese, I'm sure she's had some trauma. I'm sure there's some stress. She's not just eating like that for no reason. So we have to look at the physical body and what's happening to the body over a period of time. So I would say, like Lavon said, join us. We have a lot of research. We have a lot of information that we can share. We're going to start a series around toxic stress. Actually, the first one was October. Every month, we're going to be doing these type of webinars, just putting the information out, because flight and fright, when you know that whole scenario, when you're stressed, your body, you're constantly, you don't realize you're fighting, but you are every day, because you're being suppressed or oppressed every day. That's harmful to the body. So that's one thing, if people could join in and just go to our website. We're going to be updating it. The Policy Center will have a lot of information. And like Lavon was saying, just anytime you need us to come and present on anything, Joshua, we have a fatherhood program, we have a substance abuse program, we have so many programs in the coalition. So anytime, you all just join us.
Well, I think you're absolutely correct in terms of stress playing a big role, because Ms. Johnson, as you alluded to, it is not just, well, let me put it this way. Your economics, the individual's economics is, does play a significant role in terms of the pregnancy outcome. But then we're also looking at women of color whom are well off, smart.
Right.
Exactly. I'm not going to say rich, but have enough money to take care of, make ends meet, and they're not under the financial stress of like other ladies that we referred to and other families we referred to earlier this evening. But the common denominator is the stress. Because they may be at the job facing racism on a daily basis. And I'm not trying to blame everything on racism, but if you're at a job that's making such high demands on you, stressful, and it doesn't seem to be equitably distributed to other individuals, and it puts the monkey on your back, so to speak, to have to make sure this work gets done and that get done. And it doesn't seem to have fair distribution in terms of the work efforts and the work requirements, yada, yada, yada. then that's a form of stress. So I think the common denominator, because as you guys have alluded to earlier, Black women, period. It didn't say poor Black women, even though there's a lot of things we can point as relate to their economic situation that causes them to have that can be associated with a high fetal mortality rate. Is still at the end of the day is stress. Okay, whether it's because you got to catch two buses, or whether it's because you're trying to keep your job to help pay your bills. Okay, and even though it's a good paying job, you can't take the time off to do this. You got your kids to take care of, and sometimes us men, we have to make sure we, as good fathers and husbands, that we should help take some of that load off of you. But again, it goes back to stress, goes back to racism in the society. There is such a high role, there's a significant role played with racism and the culture of this society. A lot of this, and you guys can correct me if I'm mistaken, as far as it related to both sets of people that I just described, those who are well enough off to take care of themselves versus those who are having difficulty or financial difficulties. Access to health care, we have got to step back in this today's world, step back and see how we can provide better access to health care. Telehealth is one of the biggest things that we can help because most, I do know people need to be seen in clinics at times in the office, but other times there's some things that they may be able to take care at home and or before they get to work that doesn't require them to miss their half a day of work, which means less money coming in and the bias of your employer or your supervisor against you because you took the time off to take care of you and your baby. Okay, so I think one of the big things that we have really got to go and push forward is telehealth for access, because some of them way out in the communities, I'm just going to say like Baldwin or somewhere, hell, but North Side, the 32208, doesn't have as many, or 18 doesn't have the number of, I'm trying to even think of any OBGYN, be quite frank with you, that are in that actually, the offices actually resides in those health, those zip codes. You guys can correct me if I'm mistaken, and I know many of my colleagues, they're not in that zip code because they may be at St. Vincent, or they may be at Baptist, or they may be on South Side, and they servicing women of color, and doing their damnness to try to break that barrier for which to take very good care of women of color. But the difficulty is before it gets to them, because those women got to get access to them. And if they can't have access to them, then they can't help those women like what needs to be done. So I think other than just having more doctors' offices open in those communities, which needs to be done, at least if we can have some level of access to care, whether it's telephonically, whether it's what we're doing right now, whether it's Zoom, whether it's whatever telemedicine that we can, so that mom can discuss. Just imagine, you guys, for those who are familiar with maternal health care, if you didn't have to take that time off from work, you can pick up the phone and tell the doctor what is going on, which is what they're going to ask you when you go in there. It may take a few tests here and there, but a lot of those can be done at home.
So Dr. Kane, I want to cut you off because we're almost out of time.
Okay.
So, and we certainly can bring our guests back another time to talk about, to talk about this topic. LaVon has been wanting to chime in, but I want to interject one topic, one term that I read and I wanted to make sure I threw it out there because it's come up a lot. Dr. Kane, you first referenced it, but the heading of this particular line, and then Levon, I'll let you chime in, says factors driving disparities in maternal and infant health. The factors driving disparities in maternal and infant health are complex and multifactorial. They include differences in health insurance coverage and access to care. However, broader social and economic factors, and structural and systemic racism and discrimination also play a major role. In maternal and infant health specifically, the intersection of race, gender, poverty, and other social factors shapes individuals' experiences and outcomes. And there has been a terminology that is now I never heard of before, and that's reproductive justice. I mean, when you think about that, reproductive justice, which emphasize the role that the social determinants of health and other factors play in reproductive health for communities of color. I'm just blown away. Like every few years, it seems like it's a new terminology that's being introduced, but the issues are still the same. They're just called something different. Levon, you want to say something?
Well, initially, I wanted to jump in and mention the term epigenetics. I first think about, a few relatives that I have who they have no stress. However, their parents had stress. And they may have seen, of course, as children, we live in those households. So as adults, both one was PharmD, and she went through preeclampsia, and another was married to a physician. And I say she had no stress. But however, as a child, she did. And she again went through preeclampsia. Her baby was born at 4 pounds. And research does show that even educated women, when they
Is
have
it,
gone
is,
through.
is it me or is Levon breaking up?
Well, let me just say this while Ron is.
Levon, you're breaking up.
Can you hear me?
Yes.
Okay.
Are we still
Think
on?
about this in terms of, I understand where she was coming from with epigenetics, but I will say this as it relates to they had no stress. They didn't have some of the stress that you may identify with. But I can pretty much guarantee you, whether they were PharmD, as an ex-pharmacist, there was certain amount of stress working that job, and again, and I'm not trying to blame everything on racism, but there was a certain amount of stress working that job, and it was very racially intimidating and so on and so on in terms of me just trying to get through the process of externship, internship, just fulfilling the job. What I'm trying to say is that stress can come in different forms, and you have to be cognizant of the fact that just because a person is well off does not mean they don't deal with stress. Ask Steve Jobs. Well, you can't ask him, but you catch my drift.
Right.
Yeah, it's and I'm glad the topic came up of that it's not always about people who are from lower socioeconomic levels, because all of us has known someone in our life. It didn't matter that how much money they made. What mattered, unfortunately, was the color of their skin. And the stress of going to the job, and the jobs that we're fortunate enough to have, or the stress of living in the neighborhood. The stories that have been coming up on Dr. Phil last week, they were talking about showing different couples that were trying to buy a house or sell a house, and the stress of trying to get finance for a house, and houses being praised at thousands, hundreds of thousands of dollars less. So if we continually compound all of these different things, how can we focus on being healthy? We're told by our primary care physicians, like Dr. Kane, Faye, you talked about the importance of taking care of your health initially. But when we're told by Dr. Kane that if we don't start, exercising regularly and watching what we eat, and we're looking at diabetes or high blood pressure in our future. And it's like, doc, I want to, but you know, I, I have to do this is what I'm used to having growing up. This is, if I happen to live in a food desert, it's just so many things that are compounding. I like that Lavon brought it up, or you did, Faye, that, having those conversations with businesses. What are some things that they could put in place to make the
Yeah,
health of the woman
sure,
or their
sure,
employees easier?
sure. And I'll just jump in real quick, Josh, and I know we're wrapping up, but I can tell you, going back to Dr. King's point, what if employers allowed telehealth space in their business for their employees? That's a
Oh, yeah.
policy shift. That's a policy change. I mean, those are the type of things when we talk about going upstream, that's what you do. You get out there and show them the benefit of doing something like that. People really don't have to take off from work. They can do their appointment right there. The company encourages that type of initiative with telehealth right on the spot. I don't have to worry about, okay, if I take this time and all that. So employers could embrace those type of models and policy changes, just to use that as an example, as one for telehealth.
And that employer needs to I'll use a light term, encourage, but I'm going to use a stronger term, force, because they're paying the policy premium. Force those insurance companies to accept the telehealth model of taking care of these patients. Okay, this mother who's pregnant got to get up 4 o'clock in the morning, whether it's catch a bus, whether it's just to get the other kids ready, whatever the heck it might be, or to get her husband's breakfast ready. And of course, I can't forget the role that men play, but that's another subject. Because I can't sit back and say I'm not guilty of some things, But the bottom line is, if they want a healthy employers have to remember, a healthy employee is more productive than an unhealthy employee.
Right.
And stress is unhealthy.
Right.
And so whatever you can do to ease that stress and still promote your business needs, then that's what you do. And for other businesses to take away from your ability to conduct business, i.e., the example that Ms. Johnson just used, in terms of not allowing telehealth to be part of the insurance policy, for lack of better description. Insurance to be part of insurers' a mechanism for making sure that those people who are insured up under them are well taken care of. That will provide, where they pay for performance, so to speak, or value-based care.
Right.
If they don't push forward, not just politicians, but if the companies don't push forward the need for them to have easier access of their employees have easier access to healthcare, which definitely includes women. Okay, if they don't push forward with that, then they're going to remain in the dark ages of productivity. Right. Productivity will be better if you can accommodate your employees to a greater degree than what we're seeing these days.
Yeah.
Sounds like taking employee wellness to a different level. I'm thinking about, the allowing your employees to take a walk while they're at work, allowing them to, have a calming room for them to be able to go into and just take a break, de-stress. So we are at the end of the show. I mean, we ran out of time. Dr. Kane has been trying to force me to go to a 2-hour show. I'm like, man, we just have to bring it on to another subject. We don't want to put people to sleep by listening to us go on and on and on. But we're so grateful and that we are, talking about a very important topic of maternal health disparities. And I was sharing with someone, I can't remember who, because I talk so much and to so many people about this, that there are so many, somebody posted, what does this say?
For example,
That's
Delta
good.
Airlines
Delta Airlines open clinics, fitness centers, and pharmacies on the
Yeah,
corporate
corporate
campuses. So
office.
it's,
Exactly.
you know what I mean? So it's not a whole lot. Although a lot of employers are allowing their employees to work from home now, so companies are still going to need to step back and say, and that might be a de-stressor, but in some instance, they should also have the conversation if someone is dealing with domestic violence, being forced to work from home is not necessarily a good thing. So
Right.
give employees the option to work from home, because there are some people that's not necessarily a good thing for them to work remotely. So the more that we know about the people who we employ, obviously, the better. Faye
not step
Johnson,
back, but step up.
step up, right?
Right.
And Faye, it's such a delight to have you join us tonight. We didn't even get into some of the fatherhood work that you're doing at the coalition, and I applaud you from trying to do
Talk
this,
to him.
tackle this thing from so
Yeah.
many different angles. And I'm
Thank
sorry that
you.
Lavon was having some technical issues,
Yeah,
but
I'll check on her. Yeah, her
yeah, we
system.
like to give
Yeah,
our guests an opportunity to share their final thoughts as we end the night's discussion. So, what
sure,
are your
sure.
final thoughts?
My final thoughts. Well, really, they aren't final. Just want to say thank you for allowing Lavon and I to have this space to speak to the issues, and at anytime we can be of any assistance. But I think this gives folks an opportunity to hear the voices of those that are definitely reaching the population and in the community. And one thing at the coalition, we believe we don't do for the community without the community. We believe their voice and our work is very important. So therefore, we run focus groups, we test materials, we go to them and say, what do you think about this? And even around policy issues, we go and we think we know everything, right? And you go to the community like, that doesn't have nothing to do with me. I
Don't
say,
work.
God damn. Right. That'll have nothing to do with me. Miss J, you need to
Right.
go back with that. We're not doing that. So I just want to say thank you for allowing us to be in this space and have this time with you guys. And I appreciate it so much. And just continue to do what you do. So thank you so much.
And thank you. And as Dr. Kane said, we certainly like to have you back on the show. Oh, Lavon is coming back in. She was having
Just
some,
in time to say
yeah,
bye.
I know, just in time to say her final thoughts.
Say bye.
So, Lavon, what are your?
Yeah, we'll
We're
catch
wrapping up the show, and thank you for coming back in. And we already shared with Faye that we'd like to have you all back on the show, but we would like to give you an opportunity to say you're up. Did we lose her again? We lost her
Yeah.
again.
He's having
So,
some
Dr.
challenges.
Kane, what are
And I
your
have to
final
run, you
thoughts?
guys.
Okay, my final thoughts are real quick is this. But I think we need to make sure that they get a living wage, which means at least let a family break even with what their expenses are. Okay. And that we also need to make sure, I mean, we didn't even talk about abortion and what happened with the Supreme Court. But my thing about the abortion problem is a concern is, again, racism plays a role. You're in such a hurry to encourage people to keep babies, but then you ask them to discard the care after they're here. We have to make sure we be able to help people make ends meet when the baby does get here. So abortion, just kick that to the curb, as far as I'm concerned, uh, as it relates to um, being risque for, I mean, the current policy on abortion from the Supreme Court. We really need to be concerned more about when the babies do get here, because it's up to the woman to decide whether or not she wants to have an abortion, blah, 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 in my opinion. That's me. But still, once they get here, we need to make sure that they have an opportunity to be taken care of and make sure that family survives a pregnancy. The family survives the pregnancy um, um, once they get here.
Yep.
Thank you, Dr. Kane. And Faye, I know you need to chime away. Dr. Kane, hold tight, because I want us to say a little bit about the tridemic. Take
All
care,
right.
Faye. We'll see you
Take
Hey,
care.
soon.
You all be blessed. All right. Bye bye.
So, Dr. Kane, we in the past we've liked to interject about COVID, but I wanted to talk to you a bit before we end tonight's show. What's happening? What do we need to say to our viewers and listeners about influenza, COVID, and RSV?
The biggest thing I can say to them is that a couple of things. So the hospitals are almost as fully occupied now as they were when COVID was at its peak. Okay, during the COVID time, the COVID era of really how badly impacted our country. With that being said, what are the other reasons? A couple of other reasons that the hospital is so busy is because the gaps that are left with COVID being more or less on the down low through vaccinations, yada, yada, yada. This hasn't gone anywhere. It's still killing people. I think about 800 to 900 a day in terms of death throughout the United States. What we have to remember is that COVID is still out there, but just as importantly, the flu is making a comeback. Since we stopped wearing masks, okay, when we were wearing masks, you saw almost no flu in consideration. Definitely saw no flu for people who wore a mask, but the total the impact of influenza at that time was, I don't want to say minuscule, but very minimal, and in reference to previous years of what the influenza did. So it shows the benefit of masking is not just against COVID, but also against influenza, which is also with RSV, because that's another reason that hospitals are respiratory essential matter. One of the other reasons that hospitals are so full, especially with pediatric patients, and especially the very young, whom the RSV infection is devastating. Okay, maybe not as bad for you and I, but to give it to our grandkids, it can be devastating and deadly. So I want people to remember what does it hurt to help protect your mom, your sister, your grandchild, your child, depending on the age. How does it hurt to just wear a mask?
And Dr. Kane, someone asked me the question today, so and we can talk about it again in the future, but someone asked a question today and I wanted to toss it out there to you. They said, I need my flu shot and I need my my new COVID booster.
Right.
Can they get those at the same time?
Yes, most definitely. Please. There's nothing, we never said the vaccine would prevent COVID. We realize that, and even the manufacturers never said it. What we recognized was that it helped to decrease the severity of the COVID infection. And even, so we still have ongoing infections of COVID. However, what we do have to recognize is that some people will have much more severe responses to the presence or the infections of COVID than others. So when you get your vaccine, you not only help protect yourself by decreasing the severity of infection that you may get if you get COVID, but you're also preventing, hopefully, the infection of your loved ones. We said it in the past. Grandma, the very young, the very old, the sickly, that includes asthma and diabetes, the immunocompromised. We're protecting our loved ones by just getting the vaccination and diminishing the symptoms of COVID. Again, it's not preventing COVID infection, but it does prevent the symptoms. It keeps you alive and gets you back to work sooner and gets you back to normality sooner if you are up to date on your COVID vaccine.
And Dr. Kane, thank you for explaining that. And we won't talk about it tonight, but certainly want to bring it up at the top of the show next week. And that's something that I saw on the news today about POTS, a debilitating heart condition linked to COVID, and that is the postural orthostatic tachycardia syndrome,
Right. Yeah.
POTS and COVID-19. So
we're
as we
going to
talk
look at
about
bringing Dr. Johnson, Kim Barbell Johnson, our COVID specialist. I know,
right?
I know
So
she's listening, so we're gonna look at bringing her back.
thank you, Dr. Kane. To our listeners, thank you for your patience with us as we made a switch from talking about maternal health disparities. Had to bring up COVID 19 because we want to let people know, as Dr. Kane mentioned, that fewer and fewer people are wearing masks now. Unfortunately, other than seeing your smiling and beautiful faces, because you don't, uh, most so many people are getting what they think is a sinus infection, but when it's in fact it's probably COVID-19, which may resemble a sinus infection or a common cold. So if you get the symptoms of what you think are a common cold, many of you have received the free COVID-19 test kits in the mail. If you have not, make sure you go on CDC's website and order your supply of them, and don't make the assumption that you do not have COVID-19. Take the at-home test to rule it out, because as Dr. Kane mentioned, you don't want to expose your family members your who have underlying health conditions and be the cause of them getting sick or losing their life. As always, thank you for tuning in to Pause for the Truth. Stay healthy, stay safe, and tune in next week. Have a good evening.